Timothy Allen. Today we're going to talk about medication-assisted treatment. Medication-assisted treatment is treating opiate use disorder with medications like suboxone or methadone. This is a very effective treatment, and it helps people get off things like heroin, fentanyl, other street opiates. And sometimes it is used to help people to wean off of prescription opiates that have been used for pain control when a patient wants to get off of them. What is the most important thing that you can know about medication-assisted treatment? That is that it makes people live longer. Whenever I look at any intervention that I do for my patients, the first thing I want to do is figure out, does this make my patient live longer or not? In the case of medications like suboxone and methadone, what we see is that we reduce mortality by about 60 to 65% at 6 months compared to no treatment. Now that's nationwide data. In my own clinic, I've seen reductions that are significantly higher than that. But the whole point here is that getting off of opiates is difficult because when people try to do that, they tend to have sweats, nausea, abdominal cramping, terrible restless legs, these sorts of things that make them extremely ill. That illness goes away immediately upon using it, which is why opiates become so self-reinforcing. And so many people, once they've been using opiates for a period of time, they're not trying to get high anymore. They're not having any fun. All they're trying to do is avoid being sick. By enabling people a pathway that helps them not to be sick, I can help them to get off of these medications. I can substantially reduce their risk of overdose, and I can help them to live longer. When I explain methadone or suboxone treatment to people, I'd like to explain it as these treatments are a bridge that helps you to get to a destination. It has two nice guardrails. One is that you don't get sick. The other is that it keeps you from getting high. Like all bridges, I don't recommend that you build a house on it, but I also don't recommend you jump off it before you get to the other side. We use the bridge for the purpose that it exists, to help you to get to your goals and to rearrange your life in such a way that you don't need drugs. One of the things that some people are concerned about is that somehow they're going to become addicted to these, or that they're going to be getting high from these medications. The most important thing to understand with that is that these medications block people from being able to get high. It's much more difficult to have a euphoric reaction to other opiates if you're taking these medications. So that does help to prevent that part of the reinforcement. The second is that addiction is a complicated thing. And there's a difference between addiction and dependence. Addiction is a complicated physiologic, emotional, and psychiatric state in which people use substances in a way that is harmful to themselves and self-reinforcing. When we look at things, lots of medications cause dependency, but dependency is a different issue entirely. When we talk about dependency, for instance, I have high blood pressure, no one in their right mind would say that I am addicted to my blood pressure medicine. Well, if I stop my blood pressure medicine, the blood pressure will go up. That is not the same as addiction because I'm taking this for a good purpose. I'm not taking it inappropriately. It's not causing an emotional dependence. It's simply making me healthier. In the same way, though someone could use other opiates in order to get high, when we're treating people with methadone or suboxone, we are doing it in such a way that they may live longer, that it helps them to stay away from bad things, and the purpose is to get them away from dependence, not to add to the dependence. So, if you're considering suboxone therapy, we'd be happy to try and help you out with that. If you have any questions, feel free to give a call to the clinic. I'm Dr. Allen, and thank you for tuning in.